This is Dr. Paul Thomlinson from Compass Health Network, and I'm doing a continuing series aimed at inspiring hope and promoting wellness by applying what we know from evidence-based psychology and other sciences to the problems of the day. As this is National Suicide Prevention Month, I'm doing a couple of installments on suicide and its prevention. Part 1 was basically a top 10 list, the top 10 research findings improving our understanding of suicide prevention. In this episode, we'll talk about the major risk factors for suicide that are afoot these days, what impact they seem to be having, and more on what we can and are doing about it. Fortunately for you, in this episode, I'm going to let one of Compass Health's and Missouri's leading suicide prevention advocates, Lauren Moyer, do a lot of the talking. Lauren is Vice President of Clinical Innovation for Compass, and I know you'll take a lot away from what she has to say in response to my questions about what's up and what's being done to prevent people from dying by suicide. So, Lauren, you recently shared that according to a new report by the Wellbeing Trust, an additional 75,000 people could die from deaths of despair due to COVID-19. What does that mean? What are deaths of despair?
Great question, Dr. Thomlinson. Deaths of despair are deaths due to drug, alcohol, and suicide. The deaths occur due to the financial and economic impacts, possible thoughts of loneliness, isolation, lack of belonging, limited access to affordable health care, systemic racism, and a myriad of other traumas. These thoughts that lead to deaths are more pronounced now than ever, especially in our teens, due to the physical isolation with COVID. Deaths of despair have been on the rise for the last decade, and in the context of COVID-19, deaths of despair should really be seen as the epidemic within the pandemic.
In particular, regarding suicide, why do you think it is a more pressing concern as the pandemic wears on? Are we seeing solid evidence that suicide is actually on the rise during these difficult days we're in?
Suicide, specifically suicidal thoughts, has become a more pressing concern as the pandemic spreads and has longer-term effects on the general population, the economy, the vulnerable groups that it impacts, the isolated thoughts that people are having. These projections are definitely not without precedent. There's evidence that deaths by suicide increased both after the 1918 flu pandemic and the 2003 SARS outbreak. We're definitely already seeing this amongst some of our frontline workers in the United States as well. As far as the specific data, preliminary evidence shows basically two things. Initial decline in some instances, or a relatively stable suicide rate post-COVID. However, we have seen a marked increase in reported levels of anxiety, depression, and just in general suicidal thoughts. It's not particularly clear on how closely connected these distress signals are to population suicide rates. However, the increase in suicide thoughts is definitely alarming and concerning, and we need to do something. We need to do something as a community. We know that there are protective factors to community responses, especially to wide-scale disasters, such as COVID. But these responses are sometimes typically short-term, followed by that recovery period. So, as the pandemic remains constant and somewhat relentless, the risk of diminishing the impact of these protective factors, these community protective factors, while the stress is still present, the depression is still present, the anxiety of the unknown, suicide thoughts will increase, and it's a real concern. So we need to ramp up our prevention efforts throughout the community. Added to this is the ongoing economic impact that it's having, the increase in the unemployment rates we see, combined with possible, eviction, continued isolation. Right now, there needs to be really a proactive step in ensuring access to affordable health care, timely and affordable health care, and just implementation of suicide prevention interventions across the board.
Since we're in Suicide Prevention Month, can you tell us what we've been doing and plan to do to address these worries about more people dying by suicide? I mean, at the state level, and of course, what Compass is doing?
Yeah, great question, Dr. Thomlinson. From a state perspective, we've been working on a lot of activities. Our Missouri Suicide Prevention Network, or MSPN, we're a statewide group, and our goal is really to update, coordinate, and develop the implementation of the Missouri Suicide Prevention Plan. Currently, this group is particularly working to provide immediate resources and advocacy around suicide prevention during COVID. We really want to act as really that central repository for the state. Specifically, at a regional level, when people create their suicide prevention committees and coalitions, we want to, again, be able to share that information across the board with healthcare providers, other ancillary providers, as well as just in general, different types of groups in the community, because suicide impacts all. Also, the FCC has designated 988 as the new nationwide number for the National Suicide Prevention Lifeline, which is going to be implemented in July 2022. And our MSPN group is specifically tasked with working with the state and the Missouri Coalition of Community Mental Health Centers on how we want to roll this out. How will this be best for Missouri? In the meantime, as always, please continue to share the National Suicide Prevention Lifeline, 1-800-273-TALK, 1-800-273-8255. Also, the Department of Mental Health has been running a crisis text line campaign encouraging youth and young adults to text if they are experiencing stress, a crisis, or really just need someone to talk to. One of the messages, the caring messages, is even in isolation, we're still connected. Talk to a crisis counselor anytime you need. So in order to talk to a crisis counselor, you text MOSAFE, so MOSAFE, to 741-741. Also, the Department of Behavioral Health, in collaboration with the Coalition and MSPN, is continuing to provide free zero suicide learning collaborations. This model of care really helps centers embrace and implement the zero suicide model of care. We now also have it opened up to other entities like hospital systems, and again, this learning collaborative, this training, it's free of charge. So, we want to continue to offer that so that systems can really implement, asking the preventative measures, the treatment, and the follow-up, the individuals that are suffering from suicide need. At Compass, we've been doing a lot of stuff internally as well. We continue to promote and train on the zero suicide model of care. One of that area that we've particularly focused on this year is on safe care transitions. We've implemented same day as discharge from our own inpatient Royal Oaks Hospital, and have started implementing this with other centers and hospitals as well around the state. We also recently implemented another piece of the zero suicide model of care, and that's caring contacts. Caring contacts are brief communications with clients during care transitions, such as discharge from treatment or when individuals miss their appointments. So these contacts really promote an individual's feeling of connection to treatment. They increase his or her participation. So what we're doing at Compass is that we're sending out actual caring text messages for those who are at risk for suicide. And again, these are really there to be that extra layer of support during that time of initial crisis and ongoing, so that we're not just having it as a one-time, hey, how are you doing? But we continue to follow up because suicidal thoughts, continue to ebb and flow and last, and can last for months up to a year. We also, here at Compass, received a COVID-19 suicide prevention grant in collaboration with Department of Behavioral Health. So with this grant, we'll really be focusing on outreaching individuals not able to make it to our front door. We're also continuing to just really formalize our processes for when someone is at high risk of suicide, and continuing to develop our staff by offering lunch and learn trainings on different topics around this.
Finally, we know that hope is one of the best protective factors against depression and suicide. Can you give us your most hopeful take on this whole matter? What gives you hope as we look into the future?
Yeah, hope is everything. If we don't have hope, what do we have, right? And so as a community, as individuals, I believe there's much to be hopeful about, especially around suicide prevention. Missouri has really truly engaged in committing to rolling out a very thoughtful statewide suicide prevention plan, and make sure that we have an increased implementation of the zero suicide model of care efforts, as well as strengthen and continue to strengthen our already strong prevention community that continues to take active steps to improve care and access to services. In addition, the passage of the 988 National Suicide Prevention Lifeline legislation is one of the biggest steps the country has ever taken to provide evidence-based, accessible suicide prevention care at a national level. Again, that's something that's going to be rolled out in 2022. However, it is critical that we put in a very thoughtful plan on how to roll that out and be able to impact not only those experiencing suicidal thoughts, but just mental health issues in general. Talking about suicide can be an uncomfortable conversation. But as we continue to navigate this current health crisis that keeps us apart, as well as this time of civil unrest, those affected by this say it's a discussion we need to openly have. Suicide is truly a public health problem. We must and we have to talk about it. Talking is how we're going to save lives. Talking is how we're going to educate others. Talking is how we're going to make a difference. It's that simple. It's definitely not easy, but it is that simple.
Thank you so much, Lauren. We really appreciate you sharing your time, expertise, and passion with us. So call me Mr. Brightside, but yes, I believe there is cause for optimism in the midst of all this risk. I want us all to pursue the silver lining with all our might. Suicide rates have actually declined in the period after past national disasters, for example, the September 11th terrorist attacks. And there was no dramatic increase in suicide in the wake of the Great Recession of 2008. One hypothesis is the so-called pulling together effect, whereby individuals undergoing a shared experience might support one another and strengthen their social connections. Recent advancements in technology, for example, video conferencing, which we've all become much more familiar with, might facilitate us pulling together. Epidemics and pandemics may also alter our view of health and mortality, making life more precious, death more fearsome, and perhaps suicide less likely. But clearly, we're not pulling together to the extent that we could or should in order to make this a real protective factor against suicide. We need to find better ways and means of seeing and respecting our shared humanity, and not allow petty differences to isolate us or increase the shrieking at each other that seems to be going on so much more and more these days. And hey, wear a mask. It's a tangible sign that you care about someone other than yourself, and that maybe, just maybe, we can pull together.